Good morning, everyone. How are you all? I hope everyone is happy. God bless you and your family. One way of categorizing allergies due to divide them: seasonal allergy and perennial allergy. Once again, allergy divided in two types: seasonal allergy and perennial allergy. Seasonal allergy occurs during a specific period of time, primarily caused by climatic change. Perennial. Perennial allergy are those that occur throughout the year. Now move on. Seasonal allergy. An allergy that occurs in a particular season is more commonly known as hay fever. About 80% of Americans experience it, report the American Academy of Allergy, Asthma and Immunology. A fever occurs when your immune system overreacts to an outdoor allergen such as pollen. Allergen, something that trigger an allergic response. The most common allergen are pollens. Pollens means yellow color powdery substances from wind pollinated plants such as trees, grasses and weeds. The pollen from insect pollinated plant are too heavy to remain airborne for long, and they are less likely to trigger an allergic reaction. Hay fever comes by its name from cutting season. Historically, this activity occurred in the summer month. Around the same time, many people experienced symptoms. Seasonal allergy are less common during the winter, but it's possible to experience allergic rhinitis year round. Next one, symptoms of seasonal allergy. Symptoms of seasonal allergy range from mild to severe. The most common include severe sneezing, a runny or stuffy nose, watery and itchy eyes, itchy sinus, throat or ear canals, ear congestions, post-nasal drainage. Less common symptoms include headache, shortness of breath, wheezing, coughing. Many people with hay fever also have asthma. If you have both hay fever and asthma, your seasonal allergens may trigger an asthma. Causes of seasonal allergy. Hay fever happens when your immune system identify an airborne substances that is usually harmless as dangerous. It responds to that substance or allergen by releasing histamine and other chemicals to your bloodstream. Those chemicals produce the symptoms of the allergic reaction. Common trigger of hay fever vary from one season to another. First one, spring. Trees are responsible for most springtime seasonal allergic. Which it's one of the most common, often the northern latitude. Summer. Hay fever gets its name from hay cutting season, which is traditionally in the summer. Fall. Autumn, it's a ragweed season. The genus name for ragweed, Ambrosia, and it includes more than 40 species of old whites. Winter. By winter, most outdoor allergens lie dormant. Diagnosing seasonal allergy. Hay fever, it's usually easier to diagnose than other allergies. If you have allergic symptoms that only occur certain times of the year, it's a sign that you have seasonal allergic rhinitis. Your doctor may also check your ear, nose and throat to make a diagnosis. Allergy testing usually it's not necessary. Your treatment for allergic rhinitis will likely be the same. Treating seasonal allergy. The best medicine for hay fever and year-round allergic rhinitis, avoidance of allergen that trigger symptoms for you. Medication are also available to treat symptoms of the hay fever. Some people also try alternative treatment. Avoidance. Take steps to avoid seasonal allergy. For example, instance use air conditioner with a HEPA filter to cool your home in summer rather than ceiling fan. Medication. When you can't avoid allergens, other treatment are available including over-the-counter decongestants and antihistamines such as sterilizing and a combination of medication containing acetaminophen. In severe case, your doctor may recommend an allergy shot. There are types of immunotherapy that can be help desensitize your immune system to allergen. The symptoms of seasonal allergy can be uncomfortable. If you suspected you have seasonal allergy, talk to your doctor. They can help diagnose the case of your symptoms and prescribe a treatment plan. They will likely encourage you to take steps to avoid your allergy triggers. They may also recommend over the counter of prescription medication. Now move on. Perennial allergy. Perennial allergic rhinitis, it's a chronic allergy condition that does not subside throughout the year and causes nasal congestions and a running nose. You may feel like you have a permanent cold that won't go away. Dust mites are the most common causes of perennial allergic, but it can be caused by an allergy that is present year round. The other most common causes are cat and dog. The actual prevalence of perennial allergic rhinitis may be understood as this condition can often be undiagnosed. In childhood, boys are more likely than girls to experience perennial allergic rhinitis. However, in adulthood, difference by gender tend to disappear. While the prevalence varies depending on the study, some research show it could be quite high. You may also find that you have other disorder if you suffer from perennial allergic asthma. It's one of the most common problem that you may experience. These are condition may often go exit with the perennial allergic rhinitis, allergic conjunctivitis, learning disabilities, or media, sleep disorder. If left undiagnosed or untreated, perennial allergic rhinitis can lead to other conditions such as chronic sinusitis or abnormal growth such as polyps in the nasal cavity or sinus. Symptoms. Nasals. Nasal inflammation is the hallmark symptoms of perennial allergic. You may have some or combination of the following symptoms: congestions, itching, nasal obstruction of stuffness, running nose. If your condition has progressed to sinus or the growth of abnormal tissue, you may also experience the following symptoms: bad breath, decreased sense of smell, facial pain or fullness, headache, post-nasal drip, toothache. Diagnosis. Perennial allergic rhinitis can be diagnosed by the primary care physician but may be best diagnosed by a doctor who specialized in the disorder of the ear, nose and throat. Your doctor will talk to you about your medical history and ask you about the symptoms of the experiencing. You may also questions about things that you think might trigger your symptoms as well as your family medical history. They may be followed by the physical exam. Sufficiently, your ears, nose, and throat will be examined for conditions such as deviated septum or fluid in the ears. Treatment. Several treatment options exist for the management of perennial allergy. If a specific allergy has been identified, avoiding the substance you are allergic to may be helpful in managing your symptoms. Many you may want to work on decreasing the prevalence of allergens in your home. To do this, you may want to try adding dehumidifier if you're allergic to dust mite, cleaning and vacuuming living space on the regular basis. Get rid to pets or limit their access to bedroom. If you are unable to eliminate an allergen from your home or environment, medication or immunotherapy may be option for treating allergies. Now move on, test for allergies. There are several ways of testing whether an individual is allergic to a particular substances. Broadly speaking, these are usually a skin test or blood test. Now move on, skin prick test. How does a skin prick test work? The gold standard for allergy testing is as simple as pricking your skin, inserting a small amount of substances and waiting to see what happens. If you are allergic to the substances, a reddish elevated pump with a red ring around it will appear. This is pump may be severely itching. What except when you have the test. Before you are given the skin prick test, your doctor will talk with you. You will discuss your health history, your symptoms, and the types of triggers that seems to set off your allergies. Your doctor will use this information to determine which allergen to use in testing. Your doctor may test you for as a few as 3 or 4 substances or as many as 40. How prepare for testing? Your main task period testing to provide detail about your allergy such as when and where your allergy act upon and how your body responds. You should take antihistamine before the test. Lets your allergist know which antihistamine you usually take. Depending on how it's work, you may need to be off it for over a week time. This include cold or allergy medication containing antihistamine combined with other substances. You might test positive for allergen but never show symptoms of the allergy. You may also get false positive for false negative. A false negative can be dangerous because does not indicate the substances you are allergic to and you won't know to avoid it. It's still a good idea to get tested because identifying the substances that to trigger your allergic enable you to work with your doctor to develop treatment plan to ease your symptoms. Procedure. Perform the test. The area of your skin to be tested will be cleaned with alcohol. The doctor will make a series of marks on your skin. This mark will be used to keep track of the different allergen and how your skin react to them. A small drop of each allergen will be placed on your skin. The doctor will lightly prick the surface of your skin under each drop so a small amount of the allergen will seep into skin. The procedure it's not usually painful, but some people find it's slightly irritating. After this part of the test is complete, you will wait for any reaction, which usually peak within 15 to 20 minutes. If you are allergic to a substances, you will develop a red itch bump. The area where the allergen was placed will look like a mosquito bite surrounded by a red ring. Your reaction will be evaluated and measured. The bumps from the skin reaction usually disappear within few hours. Skin prick test can be performed on people of all ages, even infant if they are older than 6 months. It's widely used and safe in most cases. Rarely, a skin prick test can trigger a more severe types of allergic reaction. This is more likely to occur in people with a history of severe reactions. Another skin test is the patch test, which allergen containing patches are applied to the skin, usually on the back. Patch test is generally done to see whether a particular substance is causing allergic skin inflammation, contact dermatitis. Patch test can detect delay allergic reaction which can take several days to develop. Patch test don't use needle. Instead, allergen are applied to patches which are then placed on your skin. During the patch test, your skin may be exposed to 20 to 30 extract of substances that can cause contact dermatitis. These can include latex, medication, fragrance, air dye, metal, and resins. You wear the patch on your arm for back for 48 hours. During this time, you should avoid bathing and activity that causes heavy sweating. The patches are removed when you return to your doctor's office. Irritate skin, the patch site may indicate an allergy. Now move on blood test. Blood test specific immunoglobulin E blood testing, commonly called radioallergenosorbent test or immunoscap testing, measure the amount of allergy causing antibodies in your bloodstream, known as immunoglobulin E antibodies. A blood sample is sent to a medical laboratory where it can be tested for evidence of sensitivity to possible allergen. Now move on. Prevention of allergies. If you are allergic to some substances, take the following precaution to prevent allergic reaction. Number 1. If you are allergic to pet dander, cat, dog, it is advisable not to have a pet. If you have family as one, keep it out of your bedroom at the very least. If possible, do not allow it into common area such as living room. Wash your hand with soap and change your cloth after handling pets. If you are allergic to dust, including dust mites, avoid using carpets, rugs, and heavy curtain in the house, as this accumulated dust and are idle place for dust mites to settle in. Also use dust mites proof covers and pillow and mattress. Wear glass and protective mask while cleaning your room. And when you are outdoor, if you are allergic to dust, stay away from area begin cleaned or dusted. If you are allergic to pollen, keep the window of your house shut when the pollen season its peak. Restrict your outdoor activities during the season. Use a mask and glass when you are outdoor. Bath and change your clothes when you return home. If you are allergic to mold and spot, stay away from dump area where mold are likely to grow. Keep bathroom and other mold prone area clean and dry. Avoid food items and medicines to which you are allergic. Do not take any medicine without the prescriptions of a doctor. Always check the label and canned or packaged food for information on allergens. Avoid using cosmetics, perfume and other product to which you are allergic. If you are allergic to sunlight, cover yourself well when you go out. If you have an allergic reaction, see a doctor immediately. Today biology assignment. Answer the following. Learn question answers. Thank you.